Okay, we're looking at our patient Jerry Batch today. He's a male born 6/16/19XX. He's a full code status. Looks like he does have an allergy to betadine, so we'll want to keep that in mind. It looks like I'm going to go down to his most current orders. Looks like we have a current order to discontinue his indwelling urinary catheter today, which is active and due now, so that's what we're going to do. I'm going to go ahead and gather all of my supplies for peri-care as well as for when I'm discontinuing, and I'm going to go ahead and head into the patient's room. Knock, knock.
Come in.
Hi, my name is Ella. I'm going to be your student nurse today. How are you feeling?
Fine.
You're feeling okay? Good to hear. I'm going to go ahead and provide you privacy here.
Thank you.
All right. And can I have you confirm your full name and date of birth for me before we get started?
Yeah, sure. My name is Jerry Batch, and my date of birth is 06/16/19XX.
Okay, that does match what I have on your armband here. And do you have any allergies at all?
Just do betadine.
Okay, you are allergic to betadine. Okay, I'll make sure that if we use any cleansers, any disinfectants today, that they are free of betadine, but that shouldn't be a problem at all.
Okay.
Do you have any other allergies to food or meds?
No.
Maybe to adhesives or latex?
No.
Any environmental allergies at all?
No.
Okay, wonderful. All right, just the betadine. All right. Well, I'm going to go ahead and raise you up just a little bit. I'm going to make sure that your bed is locked before we get started with the procedure. I'm just going to raise you up to a more comfortable height. So today, we're going to be discontinuing your urinary catheter. So because of that, we're going to go ahead. When I'm doing that, I'm going to perform a quick genital urinary assessment as well as an integumentary assessment on your genital region, just to make sure that everything is in order before we go ahead and get that removed. Have you been experiencing any discomfort with the catheter at all?
No.
Okay. Have you experienced any burning, itching in your genital region at all?
No.
No? Okay. Have you noticed any signs of infection, any irregular discharge, or anything like that?
No, everything is fine.
Okay. In your abdomen, have you experienced, maybe felt any sort of retention or fullness, maybe in your abdomen?
No, I mean, the catheter is really working.
Okay, it's been working out well for you. Okay. And the catheter hasn't caused you any sort of discomfort upon insertion or any time after you've had it?
I mean, it wasn't comfortable at first, but I think that now I get used to it. It's fine.
For sure. Okay, good to hear, good to hear. Have you noticed, we've been documenting your output pretty regularly, but have you noticed yourself any sort of bleeding, mucus, or anything, any characteristics about the urine in your urine bag?
No.
No, not at all? Okay. We keep a pretty thorough record of that when we change out the urine, but I just thought I'd ask you just to make sure. All right, well, I'm going to go ahead and glove up. I'm going to do a quick abdominal assessment. I'm just going to make sure that your abdomen is looking and feeling okay before we get started. Is that okay?
Okay.
Okay, I'm going to go ahead and put on my gloves. And I'm going to go ahead and expose you. Is that okay as well?
Okay.
Okay. I'm going to place all of my supplies just over here on your bedside table, and I'll go ahead and expose you. Put down your gown. I'm going to put that all the way down just because we're going to be removing it. So we're going to, well, for now, I guess we're just doing an abdominal assessment. So we can go ahead and, we don't have to keep you exposed for this portion. Okay, I'm just going to look at the abdomen. I don't know any sort of distension or any sort of curvature. I'm not seeing any. It looks like it is symmetrical. It looks fairly normal. I don't see any irritation to the skin or anything like that. I'm going to go ahead and palpate your abdomen as part of my genital urinary assessment, okay?
Okay.
Okay, I'm going to start in the right lower quadrant. You let me know if you're feeling any pressure or feeling anything in your bladder or any sort of discomfort like that, okay?
Okay.
Okay, I'm going to start down here. No discomfort at all?
Nope.
Okay, all right. Now that I've noted that there's no distension, so we're not having any issues with the bladder, with the catheter draining the urine from the bladder, I'm going to go ahead and perform a genital assessment really quick. Do you mind if I expose your genital region really
No,
quick?
go ahead.
Okay. Okay. I'm just gonna, from the external look, I'm not seeing any external signs of infection. I'm not seeing any discharge. I'm also going to lift up the meatus. I'm not noting any sort of irregular discharge, any bleeding, any irritation around the catheter insertion site. I'm not seeing any sort of moisture or pressure injuries in the genital region. So it looks like you should be all set. I'm gonna go ahead and make sure that we drain everything from your catheter, and then we will go ahead and get it removed, okay?
Okay.
All right, so what we're gonna do, I'm gonna go ahead and move this down all the way. Okay, I just wanna see all that tubing. Any leftover urine in here, we just wanna make sure that we drain it into the urine bag. And we wanna do this as gently as possible as to not disrupt the catheter. That balloon is still inflated there. Okay, and it looks like I don't see anything left in this tubing here. So I'm gonna go ahead and take my disposable chucks and just lay that on the floor. And we're gonna go ahead and note the output. I'm also gonna look at the characteristics of the urine itself. I'm not seeing any cloudiness, any blood, or any external signs of infection that I should be worried about. Okay, this is still clamped, and I'm going to go ahead, we can unclip it from here. Let's see. There we go. Okay, make sure that that is fully drained. Okay, I'm gonna reclamp this cath bag, and then we will put it right back, so we're gonna dispose of it here in just a minute. I'm just gonna go ahead and set this on a flat surface and note the output. Looks like we're at just about 250 mils, so we'll go ahead and document that maybe just below, maybe be somewhere between 225 and 250. There in the middle, looks like that line is a little hard to distinguish. So now that I've taken this, I'm gonna go ahead and properly dispose this as per facility policy. So this would be in a toilet or in a sink. I'm just gonna go ahead and set this, but without leaving the patient's room, and I'm gonna set it in the commode that is in the patient's room. Okay, and I'm gonna go ahead and dispose of these chucks here on the floor as well. Okay. Now I'm gonna just change my gloves really quick before I handle this patient's catheter. Okay, I'm going to use my disposable chucks, and I'm going to place these just underneath the patient's hips. All right, do you mind if I just adjust your position a little bit?
Yeah, sure.
Okay, I'm just going to lift your legs up, just so we can get some chucks under there. Looks like we have some chucks already under there, so for the discontinuation, I'm just going to put these disposable ones under you just for some easy cleanup. I'm going to go ahead and take my syringe here. We're going to deflate this balloon. And we did put 10 mLs in, so we're going to get right around that same amount out to make sure that it is fully deflated. Okay. Looks like we've got just under 10 mLs out, but it looks like we've got all of it out, so. Okay, are you still not feeling any discomfort?
No, everything is fine.
Okay, I'm gonna go ahead and remove this adhesive to your leg. Make sure that that's not tugging on anything. All right, I'm gonna go ahead and grip the meatus. I'm gonna have you take a big deep breath in. Is that all right, Jerry? And then
Okay.
as I begin, I'm going to tell you when I'm about to take it out, and I'm going to have you exhale, okay? All
Okay.
right, big deep breath in, and take it out. Great, awesome. You still feeling okay?
Yeah.
Okay, all right, I'm gonna go ahead and observe the intactness of the tube. I'm not seeing, looks like we got all of it out. I'm not seeing any blood, mucus, any signs of infection. It looks like the tube is fully intact. So I'm gonna go ahead and grab this bag that is still anchored to the side of the bed, and I'm gonna dispose this as per facility policy. We're gonna go ahead and remove our chucks. Well, we can leave them there for pericare. We'll leave them there for pericare. And change my gloves again. All right, and you're still feeling okay, Jerry?
Yeah.
Awesome, good to hear. Okay. Now that I've taken out the tube, I'm also gonna once again note the genital region. Just do a slight integumentary assessment. After taking it out, I'm not seeing any pus or any external signs of infection, no blood or mucus coming out of the tip, so we should be all good. All right, and I'm just going to use a washcloth. We're gonna use some wet soapy water, and we're gonna go just around here, going from the top, from the Alright, now we're gonna rinse, once again starting at the top and working our way down, making sure not to contaminate. And then we'll dry as well. Okay, I'm gonna go ahead and cover you back up, okay, Jerry?
Okay.
Okay, I'll remove those chucks. Get you back into position. Put that back down. We can remove my gloves. Perform hand hygiene. All right. Looks like we are all set. I'm gonna go ahead and put you down to the lowest position. I'm gonna make sure that your bed is locked. I'm gonna go ahead and make sure you got your call light before I leave here, and I'll give you your personal belongings back here with this bedside table. All right. And I'm just gonna make sure, so right, got that bed low. There we go, call light, and you got all of your belongings. Okay, is there anything else I can do for you before I go, Jerry?
No, everything is fine. Thank you.
Okay, awesome. All right, you have a good day. Bye.
Bye.